mynews.studio.
Deep in the heart of the Amazon, Suriname has managed something remarkable. They've wiped out malaria. The question now is, can the rest of the world do the same?
Today is July 7th, 2025. Suriname has just become the first country in the Amazon to be officially certified malaria-free by the World Health Organization. That's after 70 years of effort, dense forests, shifting populations, and a disease that's been tough to control. How did they actually do it?
Let's start with the basics. Malaria used to be everywhere in Suriname's forests. Back in 2001, there were around 15,000 cases. The landscape itself makes public health a challenge. You have coastal towns, remote forest villages, and mining camps. Each of those areas needed a different approach.
So what worked on the coast didn't necessarily work inland. In the 1960s, they tried DDT spraying and better diagnostics along the coast, right? But that just pushed malaria further into the jungle.
That's right. By the 1970s, health teams realized they had to focus on the interior. They set up primary care outposts in remote villages and trained people from the local Maroon and Amerindian communities as health workers. These were trusted members of those communities, able to reach places outsiders couldn't.
And then in the 2000s, the highest risk wasn't just among villagers anymore. It was the mobile gold miners. That's a hard group to access. So Suriname adapted again. They trained volunteers from within those mining communities as malaria service deliverers. These volunteers could test, treat, and report cases, all on site.
They also sent mobile teams out to mining camps with rapid diagnostic tests and mosquito nets. It sounds straightforward, but maintaining that kind of coverage in the Amazon is anything but simple.
And it wasn't a problem they could solve alone. Malaria doesn't respect borders. Suriname worked with Brazil, French Guiana, and Guyana, sharing data, managing cross-border cases, keeping up with funding, especially with support from the Global Fund and PAHO.
So when did they see their last malaria cases?
The last case of Plasmodium falciparum, which is the deadliest type, was in 2018. The last case of P. vivax came in 2021. That means 3 full years without indigenous transmission. That's what led to the malaria-free certification.
But malaria still kills hundreds of thousands worldwide every year. Can Suriname's approach be scaled up elsewhere?
That's really the key issue. Their model, community engagement, rapid response, targeted interventions, can be adapted. But in Africa and Southeast Asia, the context is different. Large